Hello. You may know people who suffer an allergic reaction to certain foods, such as nuts and cow's milk, or to stings and bites. However, some people suffer an extreme reaction, and this is called anaphylaxis. And this video will tell you exactly what anaphylaxis is, how to recognise an anaphylactic reaction, and what you need to do. Anaphylaxis is a severe allergy. For some reason, the body reacts dramatically to a substance, such as food or a bee sting. Any substance which causes an allergic reaction is called an allergen. Within seconds or a few minutes of being exposed to the allergen, your body goes into overdrive and produces a chemical called histamine. The surge of histamine in your body causes all of the symptoms of anaphylaxis. Your tongue and throat can swell, which makes it difficult to talk, swallow, and even breathe. If anaphylaxis is not treated quickly enough, you may stop breathing, which can lead to death, although fortunately this is rare. As well as breathing problems, anaphylaxis makes your blood vessels leaky, which causes your blood pressure to become very low. This will make you feel dizzy or faint, and you may even collapse. Other milder symptoms include a red, bumpy skin rash, swollen lips and swollen limbs, abdominal pain with sickness and vomiting. Anaphylaxis is most commonly caused by a reaction to food. Examples include peanuts, milk, egg, shellfish, sesame seeds and kiwi fruit. Bee stings, wasp stings, latex and some drugs such as penicillin can also cause anaphylaxis, even in very small quantities. Once a person has suffered anaphylaxis, they are prone to having another reaction. This is why it is essential that you know how to treat it. The single most important step in preventing anaphylaxis is to avoid the allergen. Although even if you are very careful, reactions can still occur. Anaphylaxis is treated with adrenaline. Adrenaline is a medicine which reduces swelling, opens up the airways and increases blood pressure. In some countries, adrenaline is called epinephrine, which is exactly the same medicine. To give adrenaline, it must be injected into the muscle of a person's thigh. Everyone who has had or is at risk of suffering from anaphylaxis will be prescribed an adrenaline auto-injector. This can be used by anyone who is available to help, not just doctors and nurses. The most commonly prescribed brand of auto-injector is the EpiPen. An EpiPen looks like a pen with a small needle in the end and is very simple to use. All you need to do is remove the cap and push it into the person's thigh. You can even do this to yourself if no one else is around. Adrenaline must be given as soon as you suspect that someone is developing a severe allergic reaction. Signs of this include difficulty talking, swallowing and breathing, swelling of the lips, tongue and throat, as well as dizziness, sweating and becoming pale. If you believe that the person is suffering from anaphylaxis, then you must give them adrenaline with the auto-injector straight away. Don't wait or delay. You won't do any harm by giving them adrenaline. Only after have you done that should you call 999 for an ambulance. Tell the operator that the person has anaphylaxis and that you need an ambulance immediately. Even if the person begins to improve, they still need an ambulance because sometimes they may develop a second reaction. If the person starts to get worse, call 999 again to confirm the ambulance is on its way. If you have any questions about anaphylaxis or need more information, please speak to your GP, your allergy consultant, or look online at the Anaphylaxis campaign.